My name is Tom Wellman. We're just going to talk a little bit today about neck headaches or cervicogenic headaches. Oftentimes, they can be very similar to a migraine. Okay, so neck headache is more mechanical. Movements can change or alter it. A migraine is less more neurological in origin and different. So occasionally you have a neck headache that actually is a migraine and vice versa. What we want to talk about today is that we want to make sure that we do have a few patients that have come in that actually come in from other problems and said, I've got this migraine, and we've actually looked at their neck a little bit. And what we found is when they've done certain movements, it's actually reduced their headache, which they thought was a migraine. That reduced their migraine. So I bring this up because it's kind of a travesty if you have certain people that are being treated for a migraine, and part of their issues, maybe not completely, are related to some problem in their typically in the upper neck area of cervical spine, especially these upper cervical spine like C2, C3, and C4. So you can have symptoms that are very similar. In fact, some neck headache symptoms are similar to migraine symptoms. So you can have unilateral like tightness, stiffness, fogginess and such in the back here. They call the occipital area, suboccipital area. You can also have it in the side here, actually even in the eye. You can have things that are both neck headaches and migraines. You can give you blurred vision, nausea, vomiting. You can have stiffness or lack of motion. It can be moderate and severe. These are some of the similarities that sometimes you go, wow, that sounds like it should be a migraine. Well, it also can be a neck headache. So consider that when we take a look at people here, we take them through a series of movements, especially if they have the headache or migraine when they're here. We'll say, listen, let's move that neck around a little bit. Let's see if there's a change in alteration in how you feel. Wow, that migraine was a level 8, now it's a level 4. Maybe it's not a migraine. Just based on movements, a classic migraine shouldn't change that much with movements of the neck, especially movements of the upper neck area here. So I want you to kind of consider that. And there are people that have combinations. They have truly a migraine. They also have a neck headache at the same time. So those are some of the things to consider. I want you to make sure you make some good decisions and whether you actually have what you think you have. And migraines are very misunderstood among doctors, therapists, and a lot of other practitioners. So sometimes the reflexes, when they hear certain things, they hear the nausea, they see the light sensitivity, noise sensitivity, they immediately assume this is a migraine. But there are things that both migraines and neck headaches have have similar symptoms. So they can be often confused. So it's an interesting topic, but what we look at here as far as therapists here are headaches that can be changed by neck positions or movements, and that's what we'll take you through. One of the things, so this upper neck area can give you symptoms. We don't have the whole skull here. This is the back of your head here. It can give you symptoms all across the head there. So, and you can have stiffness too. So I'm not trying to say you're misdiagnosed or you don't have the correct diagnosis, but you may want to explore that because you may be able to take maybe take a little less medication or not at all if it's truly not what's going on. In fact, we're going to have a patient, we're going to interview him later on this week about his migraine and this same discussion we had. I said, wow, I was helping him with his back, and he said, I have my neck problem or a migraine problem, and we had him do some movements, and he goes, wow, this really reduced my pain, and my migraines are gone down from 8 to 4. And he's really reduced the use of Advil, some of the other specific migraine medications that he's been taking. So he's pretty psyched about it, and it's just an interesting finding, and I've noticed that over the few years. So I like to bring it up. It's just something you kind of walk away from. If you have a friend or family that has a migraine and you're not so sure, he may actually have a little combination. So consider that, think about it. One of the common strategies that we do for cervical headaches or neck headaches is just taking our hands, placing them at the base of the skull here, like that, in sitting, and essentially pull our head forward, hold it for a few seconds, and then release. I would say 10 to 15 times. You want to have a fair amount of pressure at the very end of the motion, so tilt. I like to have you tuck in a little bit and pull forward, like that. And you can see I'm just putting my fingers right at the base of the neck here. So right through here, okay? And these muscles right here, especially when they get tight too, they can tighten up and they can be a source of some headaches too. So the musculature, these small joints through here in the upper neck area. You can have headaches, believe it or not, we found in other instances, that can occur from the lower cervical segments, but they're just not as common. You can even have some that, some of my colleagues have found in the thoracic spine. But we kind of go with the most common area is here. When we come up with this stretch, it's based on taking you through a few different motions. We'll take you through bending the neck forward. We'll have you take repeated movements of that. We'll have you do retraction, retraction with extension. We'll look at all these movement patterns, rotation, and see the one that reduces your pain. So if you do the stretch at home, you should not have an increase in your headache. This is not something of a no pain, no gain. So do the stretch, do it, say 10 to 15 times, a little pressure at the end, and then release it, and you shouldn't feel worse. If you do, stop, okay? This is not a no pain, no gain. I can't say that enough. You shouldn't have more symptoms from doing that. So anyway, realize there's certain things that are in common. Migraines and neck headaches have some similarities, and just consider that. You can even have, just to go a couple that I didn't cover, you can have shoulder blade and arm pain, weakness on one side. What else do we cover? Like I said, neck stiffness and such. Those are some things just to consider. So if you have any questions or comments, you can comment right now. I hope some folks have joined us. If not, share this with your friends, or like our page. We'll probably be posting this on YouTube very soon. So if you like that, you can also check us on YouTube or subscribe. So listen, have a great day. Hopefully you'll have less headaches out there, and thanks for joining us.